There's
Okay.
one known as rheumatoid arthritis. But we have another type versus osteoarthritis,
Oh, osteoarthritis. Okay.
which is they're both very similar, but they're actually very different. Let me explain.
Mm.
You need to know that rheumatoid arthritis is an autoimmune issue. Okay. It's an autoimmune issue. It attacks multiple systems, not just not just your joints.
Okay.
Okay. It's, of course, severe inflammation. It can lead to permanent, it can lead to permanent deformities wherever it is that the joint or the bone is being damaged. And this is the major issue with rheumatoid arthritis. It's an autoimmune issue, okay? It attacks multiple systems, not just the joints. Okay, this is more of an autoimmune issue, and there's of course an inflammatory response. Your whole immune system is attacking different parts of your body, including the joints and including the heart, the membranes of the heart, the membranes of the kidneys, the membranes of the skin, the membranes of the eyes. That's what rheumatoid arthritis is. That can lead to permanent deformities. Osteoarthritis is also known as degenerative joint disease. Degenerative means it little by little it starts breaking down because of what you do as a lifestyle. So my mom cleaned houses her whole life. So my mom has osteoarthritis of her elbows, of her shoulder, and of her knees. It just depends on which joint you're utilizing. For sport athletes, it's mostly their knees because that's what that's the type of joint that they're continuously utilizing. So if you can imagine, if you have a bone, and then this is kind of what again, I know this is just like animation. It's not perfect, but if you can imagine you have a joint there and you have another joint right here. This is, let's say, your tibia, right?
Okay.
And then let's say this is your fibula right here. My point is this: if you're constantly putting pressure and you're doing a lot of physical activity, a lot of mobility in this area, in the joint area, well, the cartilage of the bones on the distal ends of the bones and the whole bursa that you have in here, the sac of fluid and the synovial membrane, all that, these become broken down through time. Okay. And that's what osteoarthritis is. Okay. It primarily affects joints. So primarily affects joints.
Okay.
The ones that that deal with weight bearing. Okay. So if it's the knees, then those are the ones. If it's the hips, then those are the ones. It depends on what physical activity you're doing. So again, primarily affects joints. It's wear and tear, meaning that it's through your occupation throughout the years, that's where the joint is being broke down. What ends up happening is, I want you to think of the joints being broken down throughout the years, and they try to repair themselves because you're continuously carrying out that movement. Like my mother, she still continued to clean houses, right? Even while her joints are trying to be repaired, the joints still being damaged more and more and more until they end up developing kind of like deposits of unfinished scar tissue inside the joint. Let me describe what that would look like right now. Hold on. What I mean by that is that they end up developing these little nodes and these deformities, and they have these projections because remember, that tissue was trying to repair itself, but because of the continuous movement, now you have almost like scar tissue developing around the joints. You see them happening a lot also in your fingers. So these are supposed to be like your phalanges, okay? Imagine these are your phalanges of the fingers, right?
Yeah.
So you end up developing these deposits of scar tissue down here as well. And these are known as your Bucard nodes, Bucards, and hold on. They're called your Bucard nodes. And I can't think of the other one. Bucards. And let me look it up real quick. Sorry. Heberden. There, I just remember. Heberden nodes. Okay.
Okay.
So what these things are the little deformities that these patients are going to develop in their fingers. I might have misspelled that Heberden nodes incorrectly, but we'll look it up in a little bit. My point is, people that utilize their hands a lot for a variety of functions. Let's say that they type. That's what they do. So
Okay.
the joints in their fingers are constantly moving around. So they develop these particular nodes, and you'll notice it on their skin because it's going to be bumpy like that. Okay. That's how you'll notice it. That's specific to your osteoarthritis, degenerative joint disease. Degenerative joint disease, the same one that I'm talking about right now, it's non-inflammatory.
Oh, okay.
It's not inflammation. You have wear and tear. You have the tissues that are being broken down because of continuous repetitive motion, not like rheumatoid arthritis, where there's a systemic inflammatory issue and the inflammation is causing destruction of the joints. That's in rheumatoid arthritis. In osteoarthritis, you have wear and tear. Does that make sense?
Yes, sir.
A lot of the medications that are being utilized for these patients are similar. For instance, if we start talking about these patients, even though osteoarthritis is not inflammation, the area right here is a little bit inflamed because, you know, of the repetitive damage. So we give NSAIDs to both.
NSAID.
Yeah, we give NSAIDs to both. Okay, ibuprofen, aspirin, naproxen. These are NSAIDs, right?
Yeah.
And so both of those, they receive NSAIDs. Osteoarthritis is also going to receive medication for just pain, like Tylenol. Okay?
Yes, sir.
However, rheumatoid arthritis, remember, what's causing the issue is this autoimmune properties. So we have to give medications that modify the immune system, that suppress the immune system's attack on its own. So we're going to give a classification of drugs known as disease modifying anti-rheumatic drugs. These are known as DMARDs. In case you ever see them. Disease modifying anti-rheumatic drugs. And some of those drugs are known as methotrexate.
Oh, okay.
And methotrexate is even given sometimes as a chemotherapy drug. But the reason why we're giving it is because it suppresses the immune system attack on whatever body parts it's attacking. And so remember, in rheumatoid arthritis, you're having these autoimmune issues. So you want to give medications like methotrexate because you want to ensure that the patient's immune system stops attacking itself. Does that make sense?
Yes, sir.
But you do that in severe cases, right, of rheumatoid arthritis. But for the most part, they're going to be getting NSAIDs. Like that's really what both of these drugs patients are going to be getting. And of course, osteoarthritis will also have Tylenol. But does that make sense, sir?
Yes, sir. Yes, sir.
Okay. We can also sometimes give steroids, powerful steroids for rheumatoid arthritis.
Okay.
Okay. All right. Any questions so far, my friend?
No, I'm good.
Okay, good. Can I clear this out?
Yeah. Yes, sir.
Okay. All right, let's continue.
So, which of the medications should a nurse identify as a treatment for this condition? Celecoxib, Misoprostol. I'll go with C.
I should have asked you final answer, but I was just, yeah, that's correct, my friend. That is correct. Write down these other drugs so that Celebrex or Celecoxib is an NSAID, which is good. It's a COX2 inhibitor, a COX2 inhibitor, which is good. I want you to know a couple things, though. This bottom one, colchicine, know that this is used for gout.
Oh, okay.
Okay.
Yeah.
We use colchicine and we also use allopurinol for gouty arthritis.
Okay.
And let me elaborate a little bit more on gouty arthritis. For gouty arthritis, the big issue is that the patient's body cannot excrete uric acid.
Oh, okay.
That's the biggest issue. For some reason, the body's metabolism, the body's system cannot get rid of uric acid.
Okay.
Please know that uric acid is also known as purines. The foods that contain uric acid are known as purines.
Okay.
Okay.
Yes, sir.
And it usually manifests in the great toe as severe inflammation of the great toe, because the purines, the uric acid, it deposits in the joints of the great toe, and this is where they deposit, and it causes really bad inflammation. Okay.
Yes, sir.
So please understand that we use both colchicine and we use allopurinol. These are the two drugs that we use for gouty arthritis. You must reduce the purines, the uric acid in the diet, to ensure that the patient does not develop any of these gouty attacks.
Okay. Yeah.
Okay. Now, this drug right here, Misoprostol, is also considered an NSAID in some cases. However, you should know that this is used for gastric ulcers.
Okay.
And I'm sorry, I said that this is an NSAID. No, I meant this is to prevent or to help with the damage caused by NSAIDs. My apologies.
Oh, okay.
So this medication, people that have rheumatoid arthritis, they take a lot of NSAIDs, correct?
Yeah.
That's the drug of choice. That's why you selected this. That's why you selected, this one, right? This is an NSAID, which is great. But you understand that NSAIDs, they damage the stomach mucus, and it can lead to a gastric ulcer. We give this medication to treat that gastric ulcer.
Oh, okay.
To prevent the gastric ulcer from developing. Does that make sense?
Yes, sir.
I want you to become very used to this drug, Misoprostol, because even though we use it for gastric ulcers, this medication as a side effect, it can lead to spontaneous abortions. It can lead to spontaneous abortions. So any woman that's taking that medication, if she's within the age where she can get pregnant, you have to let them know, hey, make sure that you're using birth control or something to make sure you don't get pregnant. Because if you get pregnant and you're taking that drug, it's going to lead to a spontaneous abortion.
Okay.
Yeah. Okay. Make sense?
Yes, sir.
All right. Any questions on the rest of them right here?
No, I'm good.
All right.